You know the European Union regulation that requires veterinarians to monitor suspicion of emerging diseases, to report them to the authorities so that a laboratory test can be carried out. Surveillance by veterinarians is recognized as the best way to monitor a group of diseases. However, this mandatory surveillance has not worked as expected, because in the field, veterinarians do not know these diseases, or not enough, to diagnose them. The absence of clinical suspicion means that mandatory monitoring is not effective. It is not real. Our poster presented at the Open Session 24 of the FAO announced that 45 French veterinarians had tested in the field a new surveillance method that works well. The new method includes the use of the Vetaid application to help diagnose emerging diseases, the missing link in the surveillance chain. This field trial was carried out thanks to the active collaboration of our partners from the National Association of French Veterinarians and the ANSES agency. The poster shows the partnership of veterinary school, the presentation of Vetaid at the World Bovine Congress, and above all, the favorable opinion of practitioners who tested the method for 6 months. The method itself was presented too quickly for everyone to see if it could be transferred elsewhere to re-establish effective clinical surveillance by veterinarians. So, let's take a closer look at this method of assisted epidemiological surveillance. And first, how can we alert a practitioner that a suspected case occurs among the multitude of his patients? Practitioner veterinarian knows that once or twice a year they encounter a bizarre clinical case which does not match with a disease known in the region. To meet the breeder's expectation without worrying him too much, the veterinarian broadens the treatment and asks the breeder for special monitoring. But there is no diagnosis for this patient who show one or more clinical signs inconsistent with domestic diseases. The concern caused to the practitioner by the inconsistencies in his diagnosis constitute an automatic alert. The new message for the practitioner is therefore, when he encounters an inconsistent clinical case, he must always consider it as a suspect case and move on to step 2. Step 2 asks the practitioner to check whether the bizarre case contains one or more of the key symptoms of the emerging diseases to be monitored. These key symptoms were sent to the practitioner at the start of the trial in the form of a poster, but they also receive them on the phones. But where do these key symptoms come from? A study of the diagnostic formula for the 19 diseases to be monitored show that these symptoms were present in almost all of the diagnostic formulas made by the expert for Vetaid. The new rule is simple. If a clinical case is inconsistent and shows one of the key symptoms, there is an emerging disease alert. And you have to test the case on the Vetaid application. So, enter the patient's symptoms on your smartphone, and in 5 to 7 minutes you have the answer. So, the opinion of the expert who built the diagnostic formula for these emerging diseases. Vetaid gives you a concordance rate between your patient and the disease, means to deepen the diagnosis, even a differential diagnosis tool. Step 4 asks the practitioner to always record the suspected case that he is testing on Vetaid. It is done in one click. If no emerging diseases is suspected by Vetaid, the false alarm case is recorded and kept by the practitioner as proof of his personal vigilance. If an emerging disease is clinically suspected, the regional surveillance managers must be alerted, and the case with all its detail sent to them in one click. Then the practitioner finds the Vetaid memo sheet here with the precaution to take, but above all, the samples to be taken and sent to the laboratory. It is these 4 well-defined steps that led the 45 veterinarians to tell you that the method is clear, easy, and effective, because they tested it and verified it for 6 months. In France, the initial partnership with veterinary school to create and validate Vetaid, the management of epidemiological surveillance by the Veterinary Association of GTV, the use of video tutorial for training have greatly facilitated its implementation. The European regulation requires each state to ensure that its veterinarians are provided with the means to guarantee that surveillance is effective. But until now, mandatory surveillance by veterinarians has not been implemented because a link was missing in the surveillance chain. Today, this missing link is available to allow everyone to re-establish passive surveillance because it is the best suited to our European need. And if French veterinarians were able to make Vetaid-assisted epidemiological surveillance work, your veterinarian can succeed as well.